enroll in a plan by March 15th, you will be covered by April 1st. So if you, and March 31st is the drop dead date, that is the closing of open enrollment, and you will not be able to enroll in a health insurance plan until November 15th of this year. So unless you have a special enrollment circumstance, like you get a new job that doesn't cover health insurance.
Or if they've dropped you.
If your employers decided to no longer cover you or to carry on their health insurance plan. So yes, those would be a special enrollment opportunity.
Mm-hmm. For people who have enrolled, and I know you have navigators who are actually going through this, but I'd ask the minimum that you guys have seen in terms of what people have had to pay, and I thought you said $0, but the highest that you've seen, you said was...
Well, we've seen anywhere for $300-400. I mean, it's really going to depend on the age of the person, the plan that they pick. You know, so it's really hard to say. I have seen the zeros. I have seen 0 amount premium, 0 amount deductible. I have seen that. It's like, wow. And then I try to get them to go to a higher plan. You know, like, wow, you could go to a gold for $8 a month. No thanks. You know, it's like, okay. You know, but that we are seeing those things, and so. I think people need to go and at least look and investigate whether or not they qualify for a premium tax credit and actually look at the plans. You know, you may not qualify for a tax credit, but if you don't have insurance, you may be able to find a bronze plan that's available on the marketplace that is inexpensive. It's better than having nothing.
Yes.
And the reality is that every adult in this country is going to be required to have health insurance. If you don't have health insurance, you will pay an individual mandate. In the beginning, the first year, it's $95 per adult in the household, or 1% of your annual income, whichever is greater. And it's just going to incrementally go up. So the question that you have to people is, are you going to pay the tax man for nothing, or are you going to pay to have health insurance? Whatever makes sense, but it would be better to have health insurance, even if it's a bronze plan. There's bronze plans out there for $300 a month. You know, and it's a 60-40 coverage. But you know what? If you end up in the hospital, I'm here to tell you, it'll wipe out your savings. You know, people that have chronic illnesses, Crohn's disease, diabetes. These folks need to have health insurance. You know, they will stay out of the hospital ERs. They will stay healthy. They will be productive people at work. All these things play into our economy that you don't really realize. You can sit there and complain about the health insurance and this, but everybody has to have car insurance. We don't think anything about that. Everybody's got to have.
And not only that, you know, you were talking about us having to pay for some of these things like the maternity and you know, things for the children and the like. But people pay for the school tax, you know, and they don't have kids in school.
Right.
I mean, there are just some things that we do as a part of being in a community, a part of society, or whatever else. And, you know, I say to people, too, you know, that who talk about sick people and, you know, let them do their own thing. But if you're breathing the same air that they're breathing, and you're out there on the road with those same sick people that are behind the wheel, I mean, what's to prevent you from getting hurt or getting damaged and having to then be laid up or whatever because that person could not get the help that they needed.
Right.
I mean, sometimes you just have to think outside of yourself and realize that there are things that we should do, that we must do in order to maintain a healthy, you know, healthy society, a healthy community.
Well, we do that here anyway. We leverage property taxes to pay for indigent health care through Halifax. That's what we do. And we know that there are people that use our emergency rooms as their primary care doctor, and they don't get better. They continue to use that because they do not have insurance. And if they had a choice, they would use a doctor. They wouldn't want to go to the ER. They would want to be better. They would not want to be sick all the time. So I beg to differ with those folks out there that say, "Oh, this is going to cost us too much." We're paying for
Already
it
paying
anyway.
for it. Yes,
We're
yes.
paying for it in our indigent care programs, our ER. We need. You look at our jails. We have people, and what do people say? Their mental health and substance abuse are primary reasons why people are in jail. If we could pay for treatment, if we could, oh my gosh, just imagine what that would do. It would alleviate some of those problems that we have in our jails, why they're getting arrested in the first place. So, if we looked at that in the bigger scheme of things, I think we would see that this is well worth it. We won't be able to see some of the attributes to this until down the road. We should be able to see less ER visits. We probably will see a healthier community. If you look at our community health assessments for this community, this is a sick town. And guess what? Employers and companies don't want to move to sick towns because sick towns cost them more money. I mean, we talk about bringing more jobs to Volusia County. Well, let's get our community healthy. We're what are you? I think we were 47 this year. Rated 47th of 67 counties, and yet look at our access to care. People talk about access to care. We have great care. We just don't have people that have coverage. So if we could get that under control, if we could move up, St. Johns County is number one. They're the number one healthiest county. Isn't that interesting? Just right up the road. Just right up the road from us. But yet our county, why is our county so unhealthy? We smoke, we drink, but if we could use our health insurance to look at our overall community health, and if our community leaders would look at how healthy our community is from a standpoint of how we bring in companies to this community, they look at those things because that's what they base their costs on. The cost of providing employer insurance is based on how well or not well your community is.
Wake up.
Oh, wow. Some other part of the health planning council is what we do. So we should have health in all policies. That's how it should work. Whenever you look at creating any policy, government policy, you should consider the health aspects of what that's going to do for our community.
And I say too that people have short memories because it was not so long ago, before Obamacare, Affordable Care Act, that health costs were going out the roof. I mean, it was not sustainable.
Well, what this act does is it puts into place quality measures. So we can no longer go along and just say, oh, just keep on coming back to the ER. There are things that says, no, when we discharge from the hospital, we want you to stay out of the hospital. So those are some things that are incorporated into the law that will make our community be healthier. And it'll make consumers be better consumers of health. No longer are we going to sit back and go to the doctor and say, oh, sure, you want to run all these tests? Yeah, sure, no problem, No, we're going to say, do we really need to do all this stuff? Do we really need to have a colonoscopy today? Can't I wait till my 5-year appointment that's coming up in 6 months? Can't I wait to get it then instead of doing one now? Can't we just treat this right now? I have those conversations with my doctor. But it makes us better consumers. If we're going to spray and pray, that's the way we're going to be our medical provider. Spray and pray. Let's just run a battery of tests without any concern of the cost. It's not going to be that way. Still, we're going to be better providers, and we're going to be better consumers of health.
And as a part of this, I know the hospitals now cannot just discharge you and then have you come right back, and then have you come right back and come right back and not deal with it.
That's why they want you to have primary care.
Yes.
They want you to have medical homes. They don't want you coming back. They know that that's at a cost to them, but also really it's at a cost to that individual.
Yes, absolutely.
No, but as a healthcare provider, you don't ever want people coming back to the ER and saying, God, this poor guy's been dealing with this for the last 2 weeks. You don't want that. Nobody wants that for an individual. I mean, we're healers. That's what we do. We want people to be healthy, and we don't want them coming to our ERs. But, we don't want them coming back and back and back again either. And so no ER provider wants that. They really don't. They do want them to stay out. But when you don't have health coverage and you don't have a medical home or anywhere to go, you're going to use the ER. And you're going to wait till you're really, really sick. That's when you go. And that's when you're the most expensive person.
And I know for Halifax, I don't know about the other hospitals, I would think they would do the same, that when they come to ER, they're going to be asking them, you know, have they considered, have they applied, why not blah, blah, this, that, and the other.
Right. Halifax does, they do have certified application counselors available to individuals, and yeah, they're going to want people to apply for the health insurance marketplace and not be on the indigent care program. It just makes sense.
Oh yes, and they, as one of the taxing district hospitals, end up picking up the tab for a lot of people that cannot afford it and do end up going to the emergency room. So it's to their advantage, but they understand too that it's to the advantage of the person and their family members too that they do get health care. And it is more affordable, so they should go ahead and do what's necessary. Now for those who are concerned about signing up, because I've heard people say too, oh, I want to go, now that everything's working fine, I want to go do it, but I don't know, what do I need when I call them, and what are they going to do? Are they going to stick their nose in my business? And you know, and then the thing that has been said about them keeping all that data on me and blah, blah, blah. Okay, so walk us through and what do they keep, if anything, and that kind of stuff?
Okay, so if someone were to come, we did an enrollment event at Deltona City Hall yesterday. We had 17 people show up, and people come, and we give them our computers. We say, here you go now, and if they're computer savvy, they know they have to create an account just like they would if they went to, you know, Books A Million or Amazon.com. Any of those things that create an account. They have to remember their passwords. We ask them to write those down so they remember them. So anytime they go back into the marketplace, they have that available to them.
And can I mention, as you're there, because I had the guy who does my nails sign up. And, you know, he had dropped his insurance 2 years ago because he was with one of those well-known, and he was paying, he said, close to $2,000 a month. And you know, relatively young person, he was making good money, blah blah, this that, and the other. But he ended up dropping it because he couldn't afford it anymore. He had to continually keep trying because of the problem with the computer, but they kept asking him for certain information too. And what he told me was that they kept, you know, he didn't have to recreate everything every time he went in, that the information was actually there. And in the end, when he finally got everything finished, everything was there. They got with him very quickly, as you've stated, and he was just amazed. I guess, you know, you just think government can't do a darn thing right,
well,
but it did.
I will tell you, it was very difficult at the beginning because the website was not functioning correctly. It was corrupting data. It was not formulating the tax deductions or tax credits correctly. It was just really very frustrating. But now that they've gotten that taken care of, what a person brings to us, if what they need is they need to know what they made last year. That's information, and some people they need their tax information. Some people just automatically know I make this much a year and that's how much I made, and they are.
And do they need to know it to the penny?
No, it's a rough, you know.
Okay, that's good.
This website. And why it had so many problems initially was because it pings against 3 databases.
That's what I told him, yeah.
Social Security Administration, Homeland Security, and the IRS. And all 3 of those databases are big data hubs. So, first of all, they know who you are.
And anybody out there who thinks, you know,
they know who you are, and they know how much money you make.
Yeah, they know.
So you can't lie about any of those things, right? So you're going to guesstimate. They're going to take what your tax returns are, and then for your person that does your nails, he would be somebody that probably has a variable income, and so he's going to try to guesstimate what his income is going to be in 2014. You have to file taxes. So I had a situation where an individual said they didn't get a tax credit, but yet they based on their income, they qualified for at least some tax credit.
Mm-hmm.
And one of the questions on the application, it says, do you plan to file a tax return? And I asked her, and she said, well, I said no, because I don't file taxes. And I said, well, you will now. So we had to fix her application, and we had to say yes to that question, because in order to get a tax credit, you got to file taxes.
Right.
So what happened with her was she was my one that came up and had 0 month premium, 0 deductibles. She enrolled in a plan, and here she was. She's just happy as could be. So what you will have with you, you have to know your Social Security number. You have to know the Social Security number of everyone that you're enrolling in a plan. So you may know your Social Security number, but you may not know your child's Social Security number.
And what if
your
they
wife's
haven't,
Social Security number.
the child is young and they haven't applied for Social Security?
I would suggest that they have to get a social on that on the child, or know the date of birth. They're going to refer. That's going to create a response from the website, and it'll refer. It'll say it appears as though these individuals are eligible for Medicaid. It appears as though these individuals are eligible for Medicare.
Wow.
It appears that this individual is eligible for Veterans Affairs. So because it knows you.
Oh.
It knows who you are.
I mean, that's awesome, just to go through that experience.
So the information that you need on the website is you need to know how much money. It's going to ask you 2 health questions, and the 2 health questions it's going to ask you is, do you smoke, and are you pregnant? It doesn't care if you have diabetes, it doesn't care if you have Crohn's, it doesn't care about any of those other types of things. So those are the information that you need to bring with you, have available to you, know that information. And so you're going to go through the website. So you need to know
income
and your Social Security numbers, and Social Security numbers of all the individuals that you're applying for. Now, once you get past the application, then you attest, you agree, is all this information correct? You check the box yes, and you just go through the application and you submit it. And then it'll come back with an eligibility determination of what your tax credit would be. Now, it may come back and say, we need more information from you. So it could ask, and then it comes up with a box that says, we need you to contact this number, and so then it'll tell you what you need to bring. But for the most part, people are cleared through. And then the next part of that is picking an insurance plan. And so the application process is relatively simple. It's very, very simple. Who's applying? How many people? And then it's male or female. When is this person's birthday? So you need to know those things. So if you're not good about remembering your wife's birthday, you probably should write all those things.
Let me say very quickly, hold
Yes.
that thought. You're listening to Truth with Gwen Azama-Edwards. My guest is George Case, and Joyce is the Navigator Coordinator for the Health Planning Council for Northeast Florida. And we're talking about the Affordable Care Act, Obamacare, as it's affectionately called. But this is WLE BIG Big, 1380 AM on your radio dial in Ormond Beach, Florida. Okay. So, for those because I can recall early on when people were saying, and that of course when there were computer problems, they were saying, oh, it takes hours.
It did.
And they were actually even saying that before there were computer problems, they were saying it takes that long, but you're saying it doesn't.
It doesn't. It is, if you have the information,
yes.
It's going to go through. And now they've added some things to the website that are windows that are sort of educational opportunities. So, like when you get in there, it'll have here are the plans that are available to you, and then it talks about the bronze plan, and so there's a little educational window, and you could sit there and read that, or if you're with a Navigator, we'll say, oh, we already talked about that, click, go to the next one. We can actually speed up that process for you, but that's really, now it's very, very quick. The websites, before the website, you got that bouncing beach ball, it just forever, and when you could never move. So now it's much quicker, it responds very quickly, so you can actually get the application done really in a setting, unless you have complicated issues with your life.
Mm-hmm.
It's for the most part, the people that I've done, they don't have that, and their application is processed. We get an eligibility determination within usually like an hour. It's done, and then it's really going through the plans.
Mm-hmm.
And some of the brokers and some of our navigators are, the person that said, well, I can only afford like $100 a month. I can't really afford anything more than that, and I really want to. I only can afford to pay maybe $10 for my doctor visits. I can't,
Mm-hmm.
and so we're going to take them to plans that we know
based
are not
on
going to
those
based on what they
parameters.
say to
Yeah.
us.
Mm-hmm.
And the brokers are going to do the same thing.
Mm-hmm.
There's some people that say, oh, I'm only going to go with Florida Blue, or I only want Florida Health Plans because I've had them forever and that's who I want to go with. And so some people make those decisions
Mm-hmm.
based on that, and so it makes it easier. But other people that have situations where they want to really, really shop, some folks have something that they need to work in, and they're told by somebody, well, you need to get a PPO. Well, maybe they can't really afford a PPO and they need to go to an HMO.
Mm-hmm.
An HMO may be cheaper for them to afford, and then they may need to really think about, well, okay, I'm going to have to get new providers, and am I okay with that?
Mm-hmm.
People don't like to change doctors, and that's something that they need to examine in their life of whether or not it's okay. Can they be okay with another doctor because that's what they can afford? Because PPO plans are more expensive than HMO plans.
Right.
And so those are some things that may take that person a little bit longer to vet out for themselves. Will I be willing to go, like let's say your plan may have your primary care physician but not your specialist.
Mm-hmm.
Or it may have your specialist but not your primary care. Are you willing to live without either of them?
Mm-hmm.
And those are the things that you really need to look at and talk about with your family members about whether or not you're willing to do those things, and then make the decisions that way. Because sometimes it's just purely. I had one individual who just said, I can only afford $100, and there was plan that was $110. He goes, I know I can't do that.
Mm-hmm.
I just can't do $110. It's like, okay, we got one here for $98. We got one,
Mm-hmm.
and his deductible was $50, so he could handle that.
Mm-hmm.
But that's the things that they need to. And this individual came back a couple of times before he actually made the choice of what plan he wanted.
Mm-hmm.
So it's shopping. I tell people, you don't go onto a car lot and buy a car and just say, over there, that's the one. You test drive it. And then you start saying, well, it doesn't have automatically locks, or it doesn't have cruise control. Are you willing to live without that, or are you willing to add $5, $10, $15, $100 to your monthly payments to have those things? It's just that simple.
Mm-hmm. Now, once you've signed up for a plan, are there opportunities later on for changing or doing anything like that? Or
yes, open enrollment is November 15th. So if you buy a plan today and you get enrolled in a plan, that plan is going to expire by December 31st, and so you're going to have to choose a new plan for the next go round.
Mm-hmm.
Okay,
or stay.
Or
you can
stay,
decide to stay or switch.
or
yeah.
stay, and you may see new providers coming on, because the health insurance marketplace had certain providers on there. Maybe there's more that are
And I'm sure there will be as time goes on.
yeah, or there may be some that come on,
Mm-hmm.
Based on their business
Same
plan.
thing happens with Medicare, so.
Right.
Yeah.
So that's just something that you would need to look at. You're gonna want to. There's plans that people are now, they purchased, they're not happy with them. They can say what if they have an issue with the plan, they can file a complaint against the plan. But the idea really is not to go there. That's very stressful. The idea is to really, really shop for something. Do your homework. Go. Florida Blue, Covington. They all have agents available to them. They all have a lot of them were doing educational things. They are actually buying you dinner and stuff. It's kind of having like a little reception, free food. Go listen to them. Listen to what they have to say about their plans and what they offer, and educate yourself about what this means to you and your family and what it's going to cost you. And then you have to decide how that fits in your budget.
Mm-hmm.
And then you say, well, I'm not going to be able to go to the movies every week. I may only be able to go twice a month or once a month.
Mm-hmm.
I mean, those are the things that all of us do in budgeting.
Yes, absolutely. And it's the same type of thing you go through with Medicare and the like. And you mentioned, just so people don't get confused, that early on in the process, because of all of that misinformation, and you got to get health care, you got to get coverage, and what's not covered and what's covered, early on you had a lot of people who were checking you out in terms of Medicare, until that date passed, that, December 7th? 7th, when they had to have selected someone or a provider. And then you were mentioning too about the medically needy, how that's not considered insurance. Just so people understand.
The medically needy program through Medicaid is not considered a adequate coverage. So if you currently are on medically needy, you will need to at least look at the plans that are available on the marketplace to make a determination as to whether or not you want to enroll in a plan. Medically needy, you're going to have to shift because you will not be eligible to continue with that when you have the ability to pay for your own plan. So it's not considered adequate care, and so it does not meet the individual mandate.
Mm.
So you'll pay for that choice down the road.
So you will be penalized unless you select.
Unless you get adequate coverage. Adequate coverage, which is what the Affordable Care Act.
Mm-hmm.
It's meant to have people have adequate coverage.
Mm-hmm.
It's just like anything out there. You want to make sure that their health care needs are taken care of. And that's why those plans that Florida Blue is ending in December, because they were not considered adequate coverage according to the Affordable Care Act. So everybody's going to have all the 10 essential health elements, and that's why those plans are being canceled.
Mm-hmm.
But now what we were telling people is that was probably a good thing. You
Yes.
probably get a better plan, more things available to you at least the same price or less for you, so at least take that opportunity to look. Take the opportunity to look. A lot of people go window shopping all the time.
Mm-hmm.
Go out there, see what's out there, and then they say, wow, maybe I can afford this. And they start thinking about, well, if I got rid of, I got Dish Network, right? That's cost me $225 a month, or my data plan on my iPhone is $180 a month. Come on. We all had to think about those things,
It is amazing what we're willing to pay for, but when it comes to stuff like that we really need, we just think, oh, that's too much.
And it's so funny because you will think nothing. People will think nothing of buying those, fancy rims for their cars. Have you ever looked at those things? They're really expensive.
I know, my husband has the money.
Wow. And it's something that if you value it, you will pay for it. That's how it works. And what this is we're actually trying to drive this market. The Affordable Care Act is actually driving and making people value health coverage, health insurance. And so, that's sort of how it's working, but we're trying to get people to understand that there is an important element to it, and it's for our community, it's for people to be well, and to purchase the health insurance, because you never know when something happens.
And as I mentioned earlier, when the cost of healthcare was skyrocketing, every year it was going up and up and up and up. It was not sustainable. So this will help the economy and what was happening in the economy, so that these dollars that were going, thousands and thousands of dollars going into healthcare will now be able to go back into the economy, so that those businesses will now be able to capitalize on those dollars that are now out there and available that were tied up in healthcare.
Right. If you got somebody that's always sick, You know, they don't feel good. They're not going to go out to dinner. You know, if you think about it, we were paying what, $50 for mammos when we went every year, $50. I was like, man, this is great. You don't have to pay for that anymore. You know, so people use flu shots. Remember, it was $25. $25. Well, now I don't have to pay that $25. Well, I'm going to put that somewhere else.
Yes, yes.
You know, it will drive the economy. There are some things that need to be tweaked. The family glitch is a big problem. That one should be fixed. They need to fix that one because affordable care for families that have coverage available to them through a spouse, that family coverage through the employer is still outrageously expensive. And the affordability is based on the employee's covered amount. So, for instance, I have 3 options available to me through the Health Planning Council. The option that I choose is the option where I pay nothing. So, to add my spouse onto my coverage is expensive. But we don't qualify for a tax credit because he has insurance available to him through my employer, and his affordability is based on my contribution, which is nothing. And that's for folks that would really qualify, young couples that are just starting out, and $500 per pay period, $300 per pay period to cover a spouse and a child. They can't afford that when they're making $30,000 a year. It's impossible. But yet they don't qualify for a tax credit because the affordability is based on the employee's portion, which is always less because it's a group plan. That needs to be fixed. That part of the Affordable Care Act has to be fixed so that we can offer that and people can get really, truly affordable coverage. And
in actuality, one of the things that I was thinking about, and what's even with the cost, which for a lot of people really will be lower, but it's probably in many ways still up there because we're really talking private sector insurers. I mean, this is private sector, and private sector basically, and you can't blame them. You know, it's the bottom line. You still got to make money. So as more people come into the system, of course, the cost is going to go down. And as the cost of health care goes down, the cost will go down. So there are a lot of things in the mix that, as we move forward, which will help to drive down the cost. It's just so key and so important that people who don't have the health care coverage do what they can to receive it and to get it, and not be fearful of a lot of what they might hear over the media or whatever else, because the bottom line is that you can check it out. Check it out. And you were saying initially too that a lot of people were just going in and checking and seeing what was what and this and that and the other. I don't want us to go off the air without letting people know that those who are on Medicare do not qualify, do not need that. You apply for Medicare, right? Those that are Medicaid eligible, they apply for Medicaid. This is for those people who do not qualify for those other things. And you were saying about those who have the employer coverage, they need to be talking to their HR person.
They need to, if they are, and they can only add somebody if it's a life event, but their HR person, they have open enrollment just like anybody else. So they can only add individuals if they've chosen this year to not add a spouse. In the event that the spouse loses the job and doesn't have coverage available to them, then that's considered a life event, special enrollment period, and the spouse could be added on. If you have a baby, you can add those on when it's not open enrollment. But for the most part, you have to take into account open enrollment when you add people. If you've opted out of it and there's no life event, okay? So, the folks that can talk to their HR and see if they can add those individuals, they can apply for an exemption either at the time of tax when they file their taxes in for the 2014 year. they can apply for an exemption if it was unaffordable to them to add their spouse through their employer. They should really go and look at the bronze plans that may be affordable coverage for them, more affordable than the employer-based coverage. It's not, won't get a tax credit, but it is something, it is coverage. It's better than nothing. You see? So, yeah, if you're eligible for Medicare, you enroll in Medicare. If you are eligible for VA, use your VA benefits. If you're eligible for Medicaid, enroll in Medicaid. Those are, you do not need to enroll in the marketplace. But
and you meet the requirement to be insured.
Requirement, that's right. So HealthCare.gov, go to www.HealthCare.gov. You can call their 800 number, it's 800-318-2596. Or you can call the Health Planning Council's 800 number, 866-295-5955. Here in Volusia County, we do have navigators that are scheduled all throughout the month of February and March, where the libraries have been so gracious to us. They've opened up their libraries, their computer labs. We are at all of them. We're at City Island, we're at Deltona Regional Library, been at Edgewater, New Smyrna Beach, Dickerson. We're everywhere. So if you need to find a navigator, we are at all the libraries, and you can find us on the library schedule at their website. And we're there all throughout the month of February and all throughout the month of March. Remember, March 31st is the last day to enroll in the health insurance marketplace. Please don't wait till March 30th. So, I'm thinking that, oh yeah, I can just do this in a day. Some people can't. But really don't wait till the last minute. That'd be a disservice to you and your family, and get enrolled while you can.
Amen, amen. Now give them those numbers again. The 800 number. 800
for the 800 marketplace. Oh, the marketplace actually has available over 150 languages. So if you have somebody in your family that has a language issue, they have all the languages available on HealthCare.gov. They can call the 800 number for that, and that's 800-318-2596. The Health Planning Council's 800 number, if you want to find a navigator in Volusia County for the Health Planning Council, you can call 866-295-5955. The library has our schedule. It's not a local number, but you can get a hold of a navigator and actually schedule an appointment with a navigator by calling locally here by calling 904-762-8605.
Okay, awesome. And just to reiterate, the computers are up and running. They're working just fine. As you had mentioned that they were shut down last week because Social Security was actually doing some of this.
Over the weekend, 3 o'clock on Saturday. If you got your application filed by Saturday at 3 o'clock, you were eligible to purchase health insurance throughout the rest of the month and have it be effective March 1st. So yeah, you can, because the 15th was the deadline for coverage on March 1st, but because of the website shutting down because of Social Security, they were going to give all these people a grace period. So if you were lucky enough to do it over the weekend, you still have that available to you.
And to reiterate too, because I said this to my friend and he was just amazed that when you give that information, you need your Social Security card, Social Security number, and the number of all those that you want to get covered. You need your income, and they can give ballpark figures close as possible in terms of their income and estimated income for next year for the 2014. But that it ties into all these 3 other agency hubs.
Data hubs. Yeah.
And that's IRS and
Social Security and Homeland Security.
And Homeland Security.
Yes, they know who you are.
Okay.
Yeah.
And for all those who say, well, there's a lot of illegals that are getting it, that is not possible, right?
No.
And in terms of they're keeping all of our data. No, that's not. That's not it either.
and we actually don't even input the data. The person does that unless they have a reason why they want us to do it. We'll do it, but we don't keep their data. We have you sign a consent with just your name on it, and that's it for us to help you. And then all the navigators are certified, registered with the state of Florida. We've attested that we're not going to share or do anything with your personal information. And there's jail time associated, fines associated. We've been background checked and fingerprinted, and we're here to help you. We're here to help you get health insurance. That's all we care about. We don't care about your social security number.
Amen, hallelujah. And I heard someone say once that, people get all bent out of shape when it comes to something that's going to help them, providing social security number and all of that. But they'll go to a store down the street that says they want to help them and say, give us and automatically they're pulling something out and they're just reading it off or they're rattling it off with no concerns or, whatever. Yeah, right. I mean, isn't it wild or crazy? What can we say? But the bottom line is that, guys, if you need health care coverage, and everybody does, and you don't, you're not already covered through Medicare, VA, or, Medicaid, employer insurance, you need to check further in that. Then you need to check it out. You need to check it out. And there's no shame in your game in checking it out, finding out, and because it's great that, the computer will come back and say, you're eligible for this, or you're eligible for that, or you're eligible for this. How do you lose in something like that?
Right.
And you help yourself, you help your family, you help the economy, you help this country. Truly. So do sign up. And I just thank you so much for coming on, helping to hopefully clarify. You never know how people hear stuff, but to hopefully to clarify what is going on in terms of the Affordable Care Act. And as I've said before, it's this portion of it, and you mentioned about the gift card, which is the Obamacare, the gift card represents the
advanced premium tax credit.
Yeah. The tax credit that you're going to get. But we've already said that Obamacare is also about prevention. It's also about helping to train medical workers that we're going to need, as we move forward. It's also about allowing parents to carry and continue their children in health care until the age of 26. It's also about removing that cap and that discrimination against women in terms of what they pay versus what the male pays for health care coverage. It's